This video is sponsored by SciSpot, the best tech stack for modern biotech.
Welcome to the show, Anton. Great to have you.
It's my definite pleasure. I'm happy to be here.
Anton, let's start with your story. What is your story?
Wow, it's an incredible journey just to get here, to get to the point in which I'm able to run a company called PepVax, a very innovative company, and also BioLab Share. As I have been able to share with other individuals, I have to start with my parents. Both immigrants to this country, no education, coming to the 1950s. My mother's first job was working as a maid for very wealthy individuals in New York City. My father's first job when he came from Jamaica was working in the factory. And basically, I guess that's where they started. And that's where they expected to be. They were just happy to come to America. But in that great melting pot called New York City, somehow the two of them got together. My father, again, being from Jamaica, mother being from Guadeloupe, and they had a dream. They had a goal. Right. A lot of times when coming from overseas, you see the streets are paved with gold, but you have to recognize you have to make your own gold. And so this is what they did. They made their own gold. And so I was born, in essence, a year after they were married. They had two other children, which are my brothers. And I saw from very young that, there's always studying. And so as I was growing up, they were in college getting their AA, the associates in nursing, and then their bachelors. When I was in high school, they were getting their masters. And when I was in college, they was getting their doctorate. And so that inspired me that education is everything. Education, once you have it, no one can take it away from you. And so as I was growing up in that particular environment, I recognized that there must be something special about them that has flowed to me, in which I will have to do something incredible, because if they did well, I must do well. Right now, they're both retired, and while they were in their education, they started buying real estate. And so right now, they are very comfortable at this particular point in time. And so how does that relate to me? Well, I must say that I was the stereotypical nerd. And so as I started my journey, they used to call me encyclopedia, because as the teacher was teaching, I would have the textbook, the math book, English book, and then I would have the encyclopedia. Back in the day, we call encyclopedia, the World Book Encyclopedia, the grandmother to Wikipedia. So they bought this entire set of about 25 different books, and I literally from 6 years old, 7-year-old, actually read the whole thing. I was always fascinated by the world and, the many different vast, portions of it. And as I was going through school, always reading, always having a book open, I kind of became that, socially, isolated. But there was in high school, there was this particular teacher that saw something in me, and it's very important. And again, that goes to one of the reasons why I have started my business, especially BioLab Share, because mentoring, opening doors is very important, because a person opened a door for me. So in high school, I was able to become that particular individual's teacher's assistant. Her name is Mrs. O'Brien, my favorite teacher. And she has recently passed, but she brought me into the lab. And in my junior year, in my senior year of high school, I prepared the entire school lab. And so she would just give me the direction and go home, and I'll sit there putting all the chemicals together for the lab and everything. And I said to myself, there must be some type of position in the world that allows me to be in the lab. I always wanted to be a physician, I guess because my parents were going to school, becoming nurses, and they had a dream of becoming doctors, but they couldn't fulfill that particular dream because they're immigrants in this country. So that kind of fell upon me, and I took that particular mantle. And so I said, I want to become a physician that had to allow me to give me an opportunity to do research. That particular experiment now moved me into my college years. And it was not the best get in there. I had a particular situation in which one of the teachers, because I was not a social butterfly, I was kind of nerdy,
Right.
didn't really care for me. And I was taking his chemistry class. And so on my last semester of the class, and this is where a teacher could be very important in terms of reaching out to a particular student. He actually failed me. So I have a pretty good grade on my senior year for that one poor grade. And I was so upset because that was something that was supposed to propel me into becoming a pre-med major in college. And while everyone else was celebrating, I'm going to college, I'm going to college, I was sad. And even before we were able to get back to that particular teacher to have that grade change to see what happened, graduation came and went. And I'm gonna share with this, my mother actually cried at my graduation, high school graduation. It's supposed to be a, joyous experience because now I've gone off into the world, I'm becoming an adult, but
Right.
it was not a very happy experience with me because of that particular situation, because how I perceive myself with my class dynamics. So I made 3 goals, as my revenge. And this is where you take your anger, you take your madness, if I could put it in that particular fashion, and say to myself, I'm going to do something positive. So I said, I'm going to graduate summa cum laude in college. I'm going to graduate in 4 years, and I'm not going to have any C's on my college transcripts. Now, mind you, I graduated from high school with less than 3-point average. And the reason for that is that in my 10th year, in my 10th grade, I barely went to school. And this is where, again, being in the company of people is very important. I was hanging out with a particular individual who didn't really go to school.
Right.
We was out when it was raining, mudsliding. Everyone would be looking at us. What's wrong with these 2 individuals? Going up into the mountains because it was a boarding school and not going to class. But somehow I got back on track. And so my high school GPA is less than a 3-point, which is less than a BA average.
Right.
And so to make a long story short, in college, I was able to graduate in the top 1% of my class, summa cum laude, with a major in chemistry, the same class I was failed in high school. That was my revenge. I was able to graduate in 4 years, and I was able to graduate with no C's on my transcript. And so that gave me a feeling that if you believe it, you can achieve it. Yes, there's obstacles, yes, there's failures, but the question is, how do you take those failures and make them your stepping stones? So one of the keys of success in life is taking those stumbling blocks and turning into stepping stones so that you can reach success. And that gave me an early experience that if I can see where I'm going, it doesn't make a difference to what other people think. It's to make a difference to what I think. If I feel that I can do it, then I can do it.
Totally.
And so I was able to get into medical school, basically any medical school that I wanted to. But, sometimes in life, when you get kind of cocky and you get kind of thinking, okay, I had this one great success, and you want to live on the laurels of your past success, there's always something to knock you down. And again, this is where mentoring could have been helpful to me. I thought I could cure diabetes in the summer. So after entering my freshman year, I actually created my own grant proposal to make antibodies to the autoimmune antigens that was causing diabetes for type 1. And I said, I can do this. And I really tried my best. This is a small grant, about $5,000. I had to fight for that. I was able to get my mice that I was working with. And then I went through the process of trying to cure diabetes. Can you believe this arrogant 22-year-old think you can cure diabetes in the summer? But I made it difficult for myself. I actually worked too hard. And I was doing 16 hours. I was actually sleeping in the lab, just to try to get this some particular research going. And so when I started out my second year, I was too tired. That means my first year was kind of like a breeze. My second year, I exhausted myself within the summertime. And that made my journey through medical school difficult. And to the such that, I was actually doing more research and studying. I was like, okay. And people was like, what's wrong with you? But that was my passion. I
Right.
think being an MD is something that's very important, especially in terms of research, to give you an interesting perspective. But I didn't balance it. And so, even though I started out with my first 2 years, I did not finish where I started. So I
Right.
did the first 2 years of medical school here in the States, and actually did my last 2 years of my clinicals overseas. But I thought that particular experience, again, humbled me, and also opened my eyes to another culture, because I was in the Dominican Republic. And one thing I
Right.
recognize about those individuals, I love the Dominican Republic people, you
Yeah.
know. And it changed my mindset, because I recognize what people need is the environment to thrive. It's not that there's anything wrong with the individual. And a lot of times we look at third world nations and we have a very disparaging view of those nations. It's not the people. A lot of times it is the government and the
Right.
other, individuals that prevent the people from being at their best, because those people were hardworking people that get up every morning trying to feed their family. And even in a country that was that poor, the crime rate was very, very low. I was like, wait a minute, it seemed like it would have been the opposite.
Right.
And so that gave me a unique experience that I'm now bringing back. That if I
Right.
create the environment, people will thrive. And that is my purpose and my passion. So when I
Right.
came back, I got a master's in biotechnology from the University of Massachusetts, focusing in biotechnology with emphasis in immunology and bioinformatics. So I am a bioinformatician and also a biotechnologist, and started working in education. So I have been able to be a professor and have that particular experience.
But three takeaways, the things that caught my attention while you were sharing your journey, your story. One is the typical American story, right? Land of immigrants. As long as you're willing to do hard work with positive mindset, sky is the limit, right? So I love your story. Other thing you mentioned I really liked is like when we are young, we wanna change the world in a day, overnight. But sometimes it takes decade, right? It's a marathon, not a sprint. And so we need patience, we need progress, consistency over a long period of time to really make a real impact. So love that learning. I think it's also great for scientists, right, in the lab, and also great for startup founders, because many startup founders want to change the world overnight, but it looks fancy from the outside, but it's real hard work for a decade or two to really create a real business. Other thing that caught my attention is like how Dominic Republic people are super talented, and the key learning is it is not necessarily about the people, it's also about the environment to empower those people, right? So they move away from survival mode to like thriving state,
Yes.
right? Because if you have limited resources, a lot of corruption, your incentives are wrong, people care about survival. And when you care about survival, you cannot really innovate, you cannot think, you cannot play the long-term game. So really, really loved what you said there. So again, very inspiring story, and can't wait to learn more about your journey as a scientist to an entrepreneur, right? So what it takes to become CXO of a biotech company from MD or lab scientist. So would love to hear more from you.
So, as you mentioned to you, as I was finished my master's, I was able to work for a particular university in the state of Massachusetts. And again, they didn't really have a research focus, and they wanted me to bring in that, particular activity. However, that particular university was having challenges. They didn't really have, again, the environment. I'm going to keep a concentrate on that, because that's very important in terms of empowering people. People want to, but they have to have the mechanism, the means, the atmosphere to
Totally.
put their ideals into fruition. And so I luckily was able to be recruited to another university that brought me from Massachusetts to Maryland. And that particular university, unfortunately, closed. And so the impetus for this particular individual bringing me to Maryland to work at this particular university is to bring research into the university. And of course, I'm gung-ho for that. Woo, I'm ready. And I had a grant all set for them and everything along that line. And that grant was about to be expired. And this grant was to create an diversified office of sponsored programs, and it was about $400,000. I had it all written up. I had one of the individuals who gave me their template for their university. And so I was like, go, here's a grant. You need to submit it. I know I start at this particular time, but if you just submit it at this particular time, the grant will go through and at least I get to respond to the grant, even though we may not get it. Has everything all written up. But again, the atmosphere, and a lot of times as a scientist, you're enthusiastic about your research. But if you're not in a particular research environment as an institution, it makes it very frustrating. And so I spent a few years banging my head against the wall. Hopefully, I kind of hide the bruises here, and to try to get research going. So yes, the individual at the top was very happy and wanted me to keep on doing this, but everyone seemed below him did not get the memo that this was supposed to be my function. So I just got frustrated. And what really put the nail in the coffin is that it was a small grant and it was from one of the granting institutions of the state to promote diversification of research among different universities within the state of Maryland. Actually gave me the grant. So it was a small $40,000 grant based on my peptide vaccines. I was working on that at that particular point in time. And one of the administrators stopped the funding of that grant.
Oh no, yeah.
Let me take a breath. Let me fan myself a little bit, because that particular grant right now is worth several $100 million to me at this particular point in time. Right. And so again, the atmosphere, if you are in the area and people like vision, your vision can't go anywhere. And so I got frustrated. Again, I keep on talking about these certain things about mentorship. I did not know how to go about starting a biotechnology company, but I knew I just had to get out of here. I knew that I had a passion to create something that can help people and lift up individuals, and everyone around me was not moving at my particular speed. And so guess what I did? I put an ad in Craigslist. Yay! That's right, Craigslist. I am starting a biotechnology company and I need a CEO, I need a CSO, I need a VP of research.
That's interesting. Did you find anyone applying for that listing?
Oh my goodness. I had about 10 to 15 people to actually respond.
Wow.
To that particular listing. I didn't know what else to do. I didn't know how to go about doing this particular process. I just knew that I wanted to take my research and build it up and move it to the next level. And it's so amazing that those individuals that came on board at this particular time are still with me almost 10 years later.
Wow.
I was still teaching, and so I needed someone to be the CEO.
I want to double click on that, especially for aspiring founders looking for co-founders. Like, how did it work? You advertised on Craigslist, 10, 15 people reached out. What was your due diligence criteria? How did you identify that the best person to really be the CEO?
I would not suggest Craigslist. I think there's other avenues in terms of recruiting. I think LinkedIn is a better platform, but LinkedIn did not really exist at that particular point in time. It was just me and my desperation.
Right.
I know that I had a good product. I know I had good research, and I just didn't know how to go out and reach people. And so that was my way of reaching people. But once you start getting the inquiries, again, this was before Wikipedia, in which people put up a profile. What you did is, interview people, talk to them, look into the background, get references from them, etc. So
Right.
one of the individuals that I talked with, I knew that he was the person. He was from India, brilliant. He did high school in 3 years, college in 3 years. He did his master's in a year. He worked for some of the largest companies. And story is really interesting because he was looking to buy a car. He had no thought that on that day that he would end up as CEO of a biotechnology company. And so he has been a great business partner from that particular time when we started the company in 2013. But there was something about him, about his enthusiasm, that said that this is the person that I would love to have run a biotechnology company. And then other individuals were suggested to me. I was lucky that I have my general counsel is also an accountant, and so I gave them equity, and so they were able to do the legal and also the accounting. And so one of the things that you want to do as an entrepreneur is make sure that you have key elements of your company taken care of. Of course, you will have to give equity to those particular individuals, but that is upfront cost that you don't have to put out.
Right.
So I have a very enthusiastic individual who's a CEO who really knows how to network. I have a person who is my general counsel, so I don't have to pay legal bills. A person that's also the accountant, so I don't have to pay my accounting fees. And then I hired another person to work with me in terms of the research. And of course, we put in a lot of in-kind work into building up the company.
You and the CEO, general counsel, plus accountant, they all came together to start this company. So you had a team. And did you structure the team solely based on equity split, or you were paying them cash as well?
Basically, it was all equity.
Got it.
So
Okay.
I didn't have, right at the beginning, it was all equity, and we
Sure.
planned together to do our fundraise
Right.
together. And so a lot of the early work within the team was in kind. And
Makes
that is
sense.
very
Okay.
important, especially with biotechnology. Biotechnology is very capital intensive. And
Totally.
so
Yeah.
you have to pay your team members at the beginning. Most
Right.
likely, if you don't have deep pockets, you can't really move forward. So I had to
Totally.
research, and the other team members put in the managerial portions to make the
Right.
company full. And then we had also a pretty extensive board of directors that was very helpful, and that also created a lot of value for the company. And so
Love it.
since we knew a lot of people, bringing in a very strong board of directors can be very helpful in attracting funds. And so we
Totally.
were able to move forward, very, very quickly and start doing our research. And the first thing that we did was target triple negative breast cancer. And
Right.
that was our first development of our
Uh,
product. Yes.
Sure. I would go back a little bit. So you have a team. Biotech, as you know, there's high cost to penetrate the market. You need more resources, right? You need more
Right.
access. So once you had your team set up, which is again, it requires a lot of time and effort to create an excellent team to really realize your vision. You had to find access to resources like lab space, like other mentors. So like, how did you find the lab space? How did you get money to even get access to lab space to perform your research?
There's approximately 500 to 600 virtual biotechnology companies. So we
Right.
started out as a virtual biotechnology company.
Uh-huh.
And
Okay.
so, and also since I am a bioinformatician, I was able
Right.
to, in essence, construct my drug on the computer.
Wow.
So
Okay.
I was able to do a lot of in silico work initially to move the drug forward. And then we brought in a particular individual and we moved to a more of a plasmid type of delivery system. So I
Right.
designed the drug, be able to configure it to a plasmid. Then we were able to get funding for our first in vivo trials targeting triple negative breast cancer.
Love it. So early stage discovery work, screening work, was done all in silico.
Yeah, so I was able to check the immunogenicity,
Right.
a computerized point of view using computers, and then design the drug, everything on the computer. Yeah, and so the next stage is how do you raise the funds? And this is where having a very incredible CEO who can work magic and very convincing, we were able to find an investor to put in the initial funds. And of course, we put in a lot of funds ourselves eventually to move the research forward. And there's a very important story in that regards. So what we did, we found a particular major funding, and we actually spun off our triple-negative breast cancer research to a new company that we created. Whew, it's kind of difficult to talk about this portion of the story. And what we did was, we set up a management team on that new company, and we did a reverse merger. So we put in $300,000, got a shell, and it was wonderful because on the first day, in essence, we went from 300,000 to 15 million. So I was jumping up and down. I'm a millionaire. Well, at least on paper.
Yeah.
And we took that ride for the next 3 years, and we had some really, really good results. In vivo work was going well. We were about to move into GLP, GMP production. We were about maybe a year, 2 years out from clinical trials. And we started to file our S1. We were going to do a $10 million raise in $2 million increments. So, and our stock prices keep on going up. So like 15 million, 20 million, 30 million, 40 million, 50 million, 150 million, 200 million. People started figuring out, who is this company that's skyrocketing, is moving up? And we were feeling so good about ourselves. We were about to file our S1 with the SEC to do a $10 million cash raise. And I looked at my net worth, it was like, wow, $30 million. Okay, that is going so good. And then the music stopped because what was happening, we were traded on the OTC. We are the only diversity managed company on the OTCs, and someone was manipulating our stock. And so we got called by the OTC, got called by SEC, and was kind of figuring out what's going on, because they stopped our trading. And once you stop trading, if you stop trading for 10 days, you're basically off of the OTC, and you're now down into the gray sheets, not even on the pink sheets, the gray sheets. And that means the value of the company just plummets. So in a nanosecond, I went from 30 million to zero. I still have not recovered from that.
I'm sure.
It was so devastating because I have worked all my entire life, and I was thinking about all the good things that I can do. Because it's not about the money, is that, am I making a positive change? Am I lifting other individuals up? Am I doing something that open up doors, especially for my ethnicity, which I have not had the opportunities? And one of the stories I did not tell you from high school is one of my heroes was an individual named Dr. Percy Julian. He is considered as one of the most famous chemists in the United States. And he was able, back in the 50s and 60s, to become a self-made millionaire. He owned his own lab, and he was able to produce his own pharmaceutical. And I said, I want to be like this person. And I was there. We had our lab space in Washington, D.C. at this particular point in time. So we had our own lab space. We moved from virtual to having a lab space. And the bubble burst. And the question is, what do you do when you are now laying face down? Now, what do you do when your entire world, everything you've worked for all your entire life is actually gone? And this is where having a good team around you, having individuals that say, this is it, I tried, I'm done. So we got back together and reconfigured our strategy. And instead of being a one drug company, which many biotechnology companies are, we decided to license our platform. And that has been very successful over the past few years. So we licensed to industry, we licensed to academia, Our particular drug delivery platform can be configured to hundreds of diseases. And so we feel that, its uniqueness makes it a very good, wonderful opportunity for individuals who want to start up their biotechnology company or individuals who want to enhance whatever product that they have, or we can enhance that product for you. And so, sometimes you have to fall forward.
Totally.
As they say, a setback is a setup for a comeback, and we
Yeah.
have that comeback, and we keep on moving forward, and doors has been opening up for us. Last year, we was able to spin off a company. We started a new company with our product, and that company is in the process of raising millions of dollars this year. But that's a validation that we are back.
Right.
But
Totally.
it took, it's taken us a few years.
So I would like to take a few steps back and would love to know more about PepVax business model, which is very interesting, right? Leveraging the platform and licensing it out to academic labs, to other biotech companies, to pharma companies, and also what is unique about your technology. Would love to discuss all of that, but would love to double click on your journey to go public via reverse merger. Like what you could have done differently to avoid what happened? And also, would you recommend other founders to explore the reverse merger route to go public? Or would you rather stick with traditional route, pre-seed, you stick with angels, and then seed and post-seed, you work with institutional investors, more equity-based? So what would you recommend in terms of fundraising from your experience now as an entrepreneur?
What I would recommend is a more of a traditional route. I would not ever again do a reverse merger because a lot of times you pick up the liabilities of the shell. And if you have not done your due diligence, you can end up with challenges. And so we end up with some of the liabilities of the reverse merger. There's other ways that you can go public that can be helpful. You could do a DPO, you could do a Reg A. There's Reg A, B, C, D, etc. But those are very time sensitive. A lot of times, people wait until they have a certain amount of VC fundings before they take that particular route. And so, the traditional model has worked. And if you can avoid doing a reverse merger, avoid it. Yes, because it is a lot of liabilities associated with it.
And do you think reverse merger is hard to control the situation? And one risk you mentioned is you can end up taking a lot of liability from the shell company if you don't do proper due diligence. Is there any other risk associated with it? Or if someone decides to go that route, how can they prevent anything unexpected?
One of the things that I now know, like for example, many of the individuals who are in their very heavy stock compensation, we look at many of the billionaires like Elon Musk, so Mark Zuckerberg, or Jeff Bezos, and you see a lot of the, we'll quote, toys that they buy. A lot of times they will use their stock as collateral. And so, that's one of the things that I probably would have done differently to bring out some of the cash, or use a collateralization mechanism to bring that out for the company. So we didn't have milestones. When you talk milestones, if you reach a certain market value, you now are able to take out some shares, and that probably could have saved our company. And so when we're at the high margin, going past 100 million and so forth, if we had a particular milestone, we probably could have taken out maybe 1% of that. And that would give us enough cash to kind of survive the SEC challenges and be able to rehabilitate the company and continue our research going, because we lost an opportunity to move a product into human clinical trials. So those are some of the business decisions that we now know that we would have done, have milestones embedded within the process so that we can take out money and use it for our research.
That's a great insight. And coming back to PepVax, technology. So what is it? Like I understand it's peptide, vaccine making technology. Would you mind discussing that in detail? What is unique about it?
Okay. So we use what's called DNA plasmid vector. And I'm not going to give you all of the details, but we are able
Sure.
to insert a nucleotide within that particular DNA plasmid that allows to express DNA, RNA, or a RNA that can lead to a formation of a protein that could be used in a immunogenic capacity to stimulate an immune response. So it could be used as a vaccine. And we have a unique sequence that allows for our particular plasmids to be expressed greater than the commercial plasmids that are out there. And we have even shown that we're better than Inovio. Inovio is
Right.
the big daddy
Yeah.
in a vaccine market, and we have better expression than their plasmids. And so that is what makes our particular product much more valuable and much more capable of doing what we say it can do than
Right.
those that are around us.
Right. And like, what is the defensibility on it? Like, is there any proprietary process? The way you do it? Do you have any patent
Yes,
pending or approved?
yes. And so this year we should have our patent approved for SmartMid. This is what we call
Sure.
our DNA plasmid protein. And then we, again, as I mentioned to you, started a new company, and we're finishing up that particular work, and we are going to do a provisional on that particular configuration
sense.
and then license it off to that new company.
Makes sense. And you talked about your business model. I'm curious, what made you decide to go more licensing route over working on your own candidates? Like if you look at Moderna Therapeutics, they also have mRNA platform, and they are focusing on many, like tens of disease indications, different therapeutic areas. But rather than licensing it out, they are creating those candidates in-house or in collaboration with other people. So like what made you or most bio startups decide to go more licensing route? Would you mind sharing some pros and cons, and like how can you navigate this through?
So the pros is that you don't have to use your own funding to move the research forward. Okay. Another pro is that you have to make the product for the individuals that is licensing the product. And so even though they may be doing the research, you are doing the production of your own product, and
Right.
we are giving you funding, in that regards. And so it gives you initial funding. A lot of times when you are bringing a product to human clinical trials, you have to get all the funding yourself. And that is just such a high hurdle.
Right.
And so that could be very challenging. The downside of licensing is that you have to find enough people to license your product in order to
Right.
maintain your company. And so that
Right.
could be a challenging, but we have a very strong product. And so we have been blessed to be able to find individuals that see the value in our product to license it.
That's great. Love everything you have done so far with PepVax, and would love to know more about BioLab Share, because I know you're passionate about empowering bio entrepreneurs. You're passionate about promoting the biotech industry and also diversifying the biotech industry. So would love to know more about your passion, your mission, vision at BioLab Shares.
Well, again, everything is part of a story. When we were trying to find a different lab, so we are still in Virginia, Washington, D.C. We wanted to move to Baltimore. Baltimore is a wonderful place for biotechnology. We have Johns Hopkins, that's close by, the University of Maryland, Baltimore, two very strong universities, and we wanted to be closer to them. We looked at Montgomery County in Maryland. It's way too expensive. They had something called a Biotech Row, which is the 240 corridor in Maryland, and it's just too expensive. NIH is there, USDA is there, a whole bunch of different, biotechnology companies there, and so the rent just keeps on going up and up and up. So Baltimore seemed like a reasonable place for us to move our labs to. We couldn't find any space. There was no space. And even with the COVID pandemic, the space have become even more of a premium. There are even less space now because billions of dollars have come into the biotech industry to take care of COVID. And then it is post-COVID. A lot of people are having those particular symptoms, and now there is a need to find solutions for those particular individuals. And so basically, lab space, wet lab space is a challenge. So I said to myself, there must be a business model here, that could be very helpful. But I wanted to do it in such a way, especially at this particular point in my life, how do I give back? So how do I create business that also will possibly impact and uplift others?
Right.
One of the challenges with the HBCUs, many of them are in financial straits, really struggling to survive, is that they have not been part of the academic IP or intellectual property revolution. Many of the top universities have geared their faculty and their students to develop products that bring revenue, passive income to them. And the disparities is just so tremendous. Last year, the United States University created close to $3 billion in STEM IP revenue. The 107 HBCUs only did 3 million. So you have 3 billion to 3 million, right? And so I'm saying to myself, if we can build labs close to these particular universities and then have students to intern, faculty to have fellowships, and have a lab space in which they could start their business, we could start a revolutionary that they can now have these particular resources that will strengthen their educational offerings to their students and also put them on a stronger financial footing. These universities are still important, unfortunately, in our dynamic to kind of mentor, kind of help students make that transition into going into the wider world. And so being within these, I won't call them cultural cocoons, but safer spaces for development is something that is necessary. So the HBCUs is still necessary in the here and now, and we want to support them. Also, I strongly believe not having more women in the field, not having more individuals of diverse background in the field is a bottleneck to biotechnology because you get a unique perspective, a unique idea, a unique way of looking at things. But if we can't present them with the atmosphere, as we talked about earlier, they cannot participate. And so we want to create that atmosphere. And so we have been able to start talks and sign MOUs with many different universities. I'm talking to my alma mater, Oakwood University, Alabama A&M, St. Augustine University, Bowie State University, Morgan State University, Tennessee State University, Key University, and so on and so forth. They have shown the interest, and we want to be able to empower them through the building of these particular labs. We are beginning to have our investors come in. Our website is all up. We're able to now take tenant applications, and hopefully by the end of next year, we'll be able to build our first lab. The land is already provided. It's all paid off, $600,000 for 6 acres in Huntsville, Alabama. That's where we're going to build our first lab. We have our debt financing all set. That lab space is going to cost us between $4 to $5 million. So all the debt finance is in. We're still raising some of our equity financing, but we feel that by getting one down and finished, as you say, if you build it, they will come.
Totally, I love it. I think the most impactful thing we can do is creating future bio entrepreneurs.
Yes.
And by helping people, particularly within minority groups or from diverse background, can be game changing, because what generally the system lacks is giving that early access to people with diverse background or minority groups. So empowering them, giving them early access, and then I think talented people don't necessarily need too much help, right? All they are looking for is early access, reducing the barrier to entry for these folks to really change the world. So what you're doing can be game changing in a couple of years, over a decade for sure. Do you want to share any final words about your thoughts about diversifying the industry further? Because biotech is potentially with like whole whole revolution of biomanufacturing is potentially a multi-trillion dollar industry, according to one McKinsey report. And I think this is one of the greatest way to empower people within minority groups or underserved or like diverse groups. So like, how do you think the whole biotech industry can uplift people from diverse backgrounds?
And that's excellent questions. When I look at different type of information, I can see that many of the larger pharmaceutical companies, they speak well of these particular efforts, but where is the implementation? And we are the implementation.
Right.
You have to not say or have an occasional meeting and bring people together. Conferences are nice, but they don't really cure people. They don't really empower people. It's just the choir speaking to other choirs.
Yeah, yeah.
But what we want to do is now get out into the field. And student internships, faculty fellowships, having the labs there, bringing the opportunities to where the people are.
Right,
And not
right.
saying to come to me, but we go to them. And I think that's one of the challenges that we have in that, the biotech industry, yes, we talk about we want to diversify, but are you going to the inner city and
Right.
have a very dynamic, biotechnology training program, for high school students or even elementary students? It said this, and I'm going to share this with you very quickly. If a student is not interested in science and math, technology, and engineering, by the time they're in middle school, they're not going to be interested at all.
Right.
And so
Right.
we lose a lot of individuals because that's when we started to teach science. We get the first science teacher in middle school. That means science wasn't interested, in first grade, second grade, third grade, fourth grade, fifth grade. They start teaching it individually in sixth grades. By then, many of the students have tuned out.
Yeah.
And so there need to be a fundamental change in education. There need to be a fundamental change in the biotechnology community to go to where the people are, so that there could be a diversification, not just talk diversity, but be and do diversity.
100%, 100%. Couldn't agree more. Well, last question before we wrap up is any advice for aspiring bio entrepreneurs, because you have managed to create successful companies and still all of your initiatives sound super promising. So what advice would you give to aspiring bio entrepreneurs or someone who is inspired by your journey and want to know like what things they should keep in mind or any takeaways they should take from this interview?
Definitely. That's a wonderful question. And I like to say this: success is defined not by how many times you have fallen. Success is defined by how you get up. And that getting up, it should always be with head held high, chest out with pride, to go forth to help those that desire your help as a servant leader. So if you have a dream, if you believe, if you want to achieve, do what you need to do to get it done and be persistent. Biotechnology is a long-term game. So you just have to have the passion. I'm going to solve this problem. And no matter how long it takes, how many mountains I have to travel over, how many valleys I have to cross over, how many rivers I'm going to have to swim the rapids, how many oceans that I have to sail and paddle through, I'm going to solve this problem because it uplifts others and makes the world a better place. That should be your passion. That should be your goal. That should be your interest. That should be your focus. And if you believe in that way.
Biotech is a long-term game for sure. It does require perseverance. It does require consistency. So thank you so much, Anton. Really inspiring talk. I'm all inspired talking to you. And we all want to say is we need more leaders in the biotech industry like you to really create the environment for future bio entrepreneurs and future successful biotech companies to bring life-saving and enhancing products to market faster. Thank you so much, Anton. Really appreciate it. talk to you soon.
Thank you very much. Goodbye.
This video is sponsored by SciSpot, the best tech stack for modern biotech.